Hello and welcome to my YouTube channel. It's Dr. Ikra here, a neuromuscular physical therapist. In this video, I'm going to talk about the journey of our little ones and gonna highlight their remarkable milestones. From the moment they came into our lives, we have watched in awe as they have reached significant milestones that mark their growth and progress. The milestones encompass their physical abilities, cognitive development, and social interaction with the emotional growth. In the part 1, we will see how to help your child in achieving the neck holding. These exercises can be used for both a normal child and the child who has delayed milestones. This may help you out being a parent. Let's start. First one is the tummy time. Place your baby on their tummy while they are awake under your supervision. This position basically allows them to lift their head and strengthen their neck. Just start with short durations and gradually increase the time as your baby becomes more comfortable. Neck muscles. Second one is the supported sitting. Sit your baby in a supported sitting position with pillows or cushion placed around them for the support, or you can use supporting chairs or seats. Encourage them to lift and hold their head up while maintaining the sitting position. You can also use some toys or objects to capture their attention and engage their neck muscles. Then the gentle neck stretches. Gently and carefully stretch your baby's neck muscle by turning their head from side to side. Start by gently rotating their head to one side, holding for a few seconds and then slowly returning it to the center. Repeat the same process on the other side. Be careful, be gentle, and ensure your baby is comfortable throughout this movement. Then the rolling activities. Encourage your baby to roll from their back to their tummy and vice versa. This movement helps develop their neck muscles by promoting overall strength and coordination. Again, you can use toys or objects to motivate them to reach and turn their head during the rolling process. And the visual tracking. In this, engage your baby's neck muscle by stimulating their visual tracking skills. Hold colorful toys or objects at eye level and move them from side to side. Encourage your baby to follow the objects with their eyes, which will naturally engage their neck muscles. Always remember, every baby develops at their own pace. So it is important to be patient and provide plenty of support and encouragement. If you have any concern about your baby's neck control or if they are experiencing any difficulties, it is advisable to consult a pediatric physiotherapist who can provide individualized guidance and exercise specific to your baby's needs.